Hi everyone, welcome back to another episode of Answers in Overly Simplified Science, and we are going to cover the rest of this Answers in Genesis Heart article. We're talking about embryology today, and as you all know, I love talking about embryology. And of course, they're going to mess it up. So we're going to discuss my concerns with this little piece here in their article. It's called A Healthy Whole. Ever wonder what a baby does with his lungs before he's born? And I don't know why they're gendering this baby. It doesn't matter what gender or biological sex you are. Lung development and heart development they're not gendered. So I don't know why they're doing this. But anyway, he can't breathe air inside the womb. His lungs are not used. Instead, his blood vessels are temporarily attached to his mother's placenta where they absorb nutrients and oxygen. This is true. They're not wrong yet. The lung develops until birth without being called upon to function. In fact, a baby can be born without lungs and survive until the placenta is removed. In contrast, the heart is critical to life from the start. It is the only vital organ that must function from the beginning stage of its development. The heart starts beating at 5 weeks. Okay. So I'm going to disagree with them here because yes, the heart needs to function. But other organs need to function, and even needing to function within the womb is really important. And I know I've talked about the kidneys before in other parts of this article, but the kidney is a very underrated organ and has a lot of important functions. And the baby, when it's in the womb, is sitting in amniotic fluid. And this process of producing amniotic fluid, the fluid's produced, the baby's going to swallow some of it and then pee it back out. So these kidneys need to be functional. And in fact, if you have improper kidney development, you're going to have problems producing amniotic fluid. And this can lead to something called Potter sequence, where the baby is constricted in the womb because there isn't enough of a fluid buffer for them, and they get trapped, and they can have improper lung development. Their limbs don't develop properly, and it's very dangerous, and oftentimes this kills babies. So your kidneys need to function from the very beginning as well. And so they are incorrect here in saying that the heart is the only vital organ that needs to function from its beginning stage, because other organs need to as well. And so they're just putting way too much importance on one thing. Next, they're saying that since the baby's heart does not yet need to devote one of its pumps to circulating blood to the lungs, the heart develops a small hole called the Foramen Ovale in the wall that separates the two pumps. The baby also develops a small vein called the Ductus arteriosus, which allows blood to bypass the lungs and move directly to the body. And they are correct. You do have a Foramen Ovale. When you're forming your atrial septum in your heart, you do have a little hole, and this does allow blood to bypass the right side of the heart, go directly to the left, because you don't need to worry about oxygenation. That is correct. And you do have the ductus arteriosus, which allows blood to bypass pulmonary circulation, go directly into systemic circulation. So they are correct here. But what they're going to say next is really where I'm going to disagree with them. So they say, at birth, a marvelous transformation takes place. When the lungs inflate and the baby takes its first breath, the pressure in the heart shifts, forcing the flap over the foramen ovale to close the hole. The body also produces chemicals that cause the bypass artery to close. Yes, most of the time. And then they continue on, and I'll just read the rest of this, and then I'll go into my whole little spiel about what actually happens. So by marvelous design, the baby emerges from its watery home and breathes the air without a glitch. The blood begins pumping to the lungs to absorb oxygen without a moment's delay. This would be correct if everybody followed this same pathway, and if nobody's heart ever made a mistake, which, if you've been to my channel before, you know that this never, or at least rarely, ever goes as planned. So I'm going to talk about a few reasons why. So first of all, talking about the foramen ovale, there is a congenital defect in the heart called patent foramen ovale, where this hole stays open. And if you can imagine, this might be a problem, because then blood that is supposed to go to the lungs can actually start going to systemic circulation. And so you have deoxygenated blood that's floating through the rest of the body. This can be dangerous. Patent foramen ovale is actually present in 25 to 30% of the general population. It's very, very common. The thing is, though, most people end up being asymptomatic because most of the time the pressure from the left side of the heart is greater than the pressure from the right side of the heart. And so most of the time, even with this hole, more often blood from the left side is going to shunt to the right side. And this really isn't a huge deal because if you have oxygenated blood that's going back to the lungs, and then just kind of going the long way to go back to the body, that's not a huge issue because you're getting oxygenated blood everywhere that it still needs to go. It's not as severe as somebody who has deoxygenated blood that's going to places that need oxygenated blood. So most of the time, this is asymptomatic, and you might not even know. A lot of people with this go into adulthood and they may not know that they have a patent foramen ovale. But where this does become a problem is that they have risk for other cardiac issues. They have higher risk of right atrial tumors. They have risk for shunt reversal, like I said, where you have deoxygenated blood, that the pressure in the right side of the heart can increase and overpower the left side of the heart, causing deoxygenated blood to flow. And this would usually happen, let's say you're doing some strenuous activity, such as like lifting weights, or if even when you cough, you cause some pressure to build up in your heart that can cause this shunt to reverse and go in the bad direction. You also get increased risk of something we call paradoxical emboli. So since you have this hole in your heart now, normally when you have a blood clot that's moving to your body, it's going to go through the rest of your body, get stuck somewhere, and usually not end up in your lungs if it's arterial. But in this case, you can get an arterial clot that goes back into the lungs. So we call it paradoxical because it's not the usual direction it goes, but you are at increased risk of this, and this causes you to be at increased risk of strokes. It also causes increased risk of decompression sickness if you were to go scuba diving. Let's say you didn't know that you had a patent foramen ovale and you went scuba diving. You are more likely to be at risk for decompression sickness. So these are just multiple issues that can arise from having a patent foramen ovale, and we can do things to help the foramen ovale close. If we catch this when someone is a baby, we can give certain medications that can help this happen. And so it's not usually a huge deal, but it is evidence that not everybody has a functioning heart, and the heart doesn't always work so perfectly every time. There's a lot of error that can happen. The next thing I want to talk about is called the patent ductus arteriosus. And so the ductus arteriosus, as I mentioned, this is a shunt from the pulmonary circulation to the aorta, making blood go directly to systemic circulation and bypassing the lungs. So you get a similar issue here with deoxygenated blood going to the rest of the body and then dealing with hypoxia because you're not getting oxygenated blood where you need it. This is also, it's not as common as PDA or, patent foramen ovale, but PDA, patent ductus arteriosus, it occurs in about 3 to 8 out of 10,000 live births. So that doesn't sound like a lot. But it is decently common, and it's also usually asymptomatic. But if you were to listen to somebody's heart who had this, you would probably hear what we call a continuous flow murmur. So you'd hear a murmur that really never stops. It just keeps going, and this is pretty benign. So if you have a small patent ductus arteriosus, you're probably not going to have a lot of problems. But as you get older, you might have some issues with your arterial pressure if the ductus arteriosus is still small enough. But if you have a bigger open space and you have more deoxygenated blood that's flowing where it shouldn't be going, you're going to have issues with exercise tolerance. So you're not going to have the endurance to be able to do a lot of aerobic activity. So like running is going to be more difficult because you don't have enough oxygen to undergo that kind of activity. Also, something that you get with a high defect, like a large size defect, is a high volume overload of the left ventricle. And so you're going to get some hypertrophy. And this is another example where hypertrophy can be dangerous. You're going to get dilation of the heart. So it's going to grow, but it's going to grow with a lot of space inside. So your heart's going to take up more space, but the inside of the heart's not going to have as much mass to it. So you're going to have a lot of dysfunction. It's not going to be able to pump as well. And this can be a problem. So you're going to get some heart disease, and we call it cyanotic heart disease, where you're not able to oxygenate the rest of your body. Your fingers and your toes might turn blue. Your lips might turn blue. And these are all signs that you're not having adequate oxygenation. You're not breathing appropriately. Like, your body's not breathing appropriately. And so this is another pretty common example of why the heart isn't so perfect and how it can frequently mess up in development. And then finally, talking about the baby emerging ready to breathe air is it's actually not a common situation that a baby's just going to be ready to breathe right away, especially where a lot of babies are born prematurely. I'm sure many of you know of a baby who's been in the NICU right after they're born. A lot of times they have to go on oxygen right when they're born, because there's a phenomenon called neonatal respiratory distress syndrome. And this is very, 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 very common because in order to inflate the lungs once a baby is born, it has to produce surfactant. And if a baby is born prematurely, they probably have not produced surfactant. Surfactant is naturally produced later on in the pregnancy when the baby is about to be born. So somebody that is born prematurely is not going to produce surfactant, and so they're going to have a lot of surface tension in their lungs. Their lungs are not going to be able to expand, and so they can't breathe. And so that's why they're going to need to go on oxygen. They're going to be given some medication to help them with this issue and be able to breathe. And so these are all very common embryologic issues that can arise. So the fact that Answers in Genesis is willing to say, yeah, this is all intentional, this is all God making these embryologic things happen. And yes, it's great when these things work perfectly, but rarely do they ever work perfectly. And so that's pretty much all we got here. I hope you liked this series on Answers in Genesis. I have some other articles from them that I would like to review. So let me know what you think in the comments down below. Please like this video, subscribe, and I will see you all in the next one.